Dyslipidemia. Elevated cholesterol or dyslipidemia is a common medical problem, a common diagnosis that we see in the outpatient center, outpatient clinic, and it is associated clearly with coronary artery disease and stroke. So elevated cholesterol is associated with a person having a heart attack, having a debilitated stroke, as well as many other medical complications. What I'd like to talk to you about today is an overview of dyslipidemia. I'd like to cover the reasons it's important to monitor, to measure and monitor, risk factors for elevated cholesterol, how we make the diagnosis, what treatment regimens are available, the side effects that are possible from some of the medications that are out there, how we continue to monitor cholesterol levels, and what are some of the goals. So let's start off with risk factors. Definitely lifestyle is a significant risk factor. So sedentary lifestyle where there's not much exercise or cardiovascular exercise, a lifestyle where there's increased calorie intake and high fat intake is associated with high cholesterol, and genetics play a big role as well. So you may have a perfect diet and you exercise all the time, yet your cholesterol level is elevated. There is likely a genetic component associated with this in how you metabolize fats in your body. So how do we diagnose high cholesterol? Well, you'll go to your primary care physician's office and you'll do a fasting blood sugar, a fasting lipid profile. So what is a fasting lipid profile? A fasting lipid profile, you come into the office, you haven't eaten since 12 o'clock midnight the night before, and they do a blood test that checks your cholesterol level. And it looks at the LDL, which is considered the bad cholesterol, the low density lipoprotein. It looks at the HDL, the high density lipoprotein, which is considered the good cholesterol. It will, the test looks at the total cholesterol, and it also looks at your triglycerides. This is an important initial test in evaluating you for elevated cholesterol. And, you know, we want the LDL to be low. So we want, you know, in a general population, we want it to be under 130. In patients with diabetes, we want it under 100. In patients with coronary artery disease, we want it under 70. So there's different degrees or different goals that we try to attain with regard to cholesterol levels. As far as your HDL goes, that's the good cholesterol. We want that to be elevated, so we want that to be over 40 in most cases. We also want your triglycerides to be low. We want those numbers to be under 150. Elevated triglycerides are not only associated with high cholesterol dyslipidemia, but it's also associated with pancreatitis. So if you have very high triglyceride levels, your risk for developing acute pancreatitis goes up. There are other tests that are available, and your primary care physician or cardiologist may want to do these additional tests. And these are go by the name of VAP or NMR. They're panels that basically break down the cholesterol particles a little bit more, and they start looking at lipoprotein or LPA levels that are associated with increased risk for coronary artery disease and stroke, and they also look at small, dense LDLs. So they look at the LDL, the low density lipoprotein, which is the bad cholesterol, and they break it down by density to see, by density and size, to see what these particles look like based on what they look like, particularly the small, dense LDLs. If those are high, your risk for coronary artery disease and stroke is increased, and so the management changes slightly. Talk to your primary care physician about these additional tests that are available. So let's talk a little bit about treatment. As far as treatment, the initial mainstay treatment is lifestyle modification, changing your diet, doing things like eating less saturated and trans fat foods, and basically less fried foods, and more mono and polyunsaturated fats, similar to what you would find in the Mediterranean diet, trying to do things that will decrease oxidative stress in your body. These are things, this along with routine exercise, cardiovascular exercise, and the type of exercise that you do is basically dictated by your overall fit level, and you need to speak with your physician about what would be the best strategy for you. But basically, if you're concerned or if you have elevated cholesterol, the first thing that we try to do is let's change lifestyle, let's change diet, let's change exercise routines, and see if we can lower those LDL and triglycerides by doing that. Next steps are medications, and these, the mainstay, are basically statins. They also go by HMG-CoA medications, and these medicines will lower, there's a variety of medicines, and some of them are milder than others. Some of the weaker ones are pravastatin, some of the stronger ones are Lipitor and Crestor and Zocor. So depending on what kind of lipid profile you may have, your primary care physician will start you on the appropriate medication. These medicines are not without side effects. The most common, although not very common, but the most common side effects that we see are muscle aches or myalgias. These medicines are metabolized through your liver, so it is important that before starting these medicines you have a baseline liver function study by your primary care physician, and then subsequently later on, after 6, 9 months, or 12 months, you can have a follow-up cholesterol, liver profile to ensure that your liver is metabolizing this medication without any problems. Once you're started on cholesterol-lowering medications, your primary care physician will likely check yearly cholesterol levels to ensure improvement. Again, the goals and how aggressive we are with the treatment and the use of these medicines depends on how high your cholesterol is, as well as your risk factors, looking at family risk factors, looking at your own risk factors, including diabetes and a history of existing coronary artery disease or a high risk for developing coronary artery disease. Talk to your physician, determine if your cholesterol is elevated, and work on, if it is elevated, diet, exercise, and or medications to lower the cholesterol. Don't go the majority of your life with known elevated cholesterol without treatment, because ultimately the likelihood of you having a stroke or a heart attack from this is very high if it's untreated.